This is another early fetus at about 8 weeks. It is still too early to see a fetal profile. Can you see the yolk sac in this scan? Here we show the yolk sac. The yolk sac is visible from 6 to 7 weeks. It is present until the end of the first trimester, but we often can't see it later in the first trimester. These calipers are well positioned for the longest fetal measurement for the crown rump length. In older fetuses, you can identify the face and limbs. To measure the crown rump length correctly, the fetus must be in the correct position. Usually, the mid-sagittal plane will give us the best view. First, the fetus must be lying in a neutral position. This means not bent or flexed, and not with an arched or extended back. Secondly, the fetus must be in profile, meaning you can see the face. If the fetus was turned toward or away from us, you could not see the face. Again, in early pregnancies, it is often not possible to see the face. To measure a crown rump length, we measure from the top of the head to the outer edge of the rump. Do not include the fetal limbs and yolk sac. Please pause the video now to ask your trainer to demonstrate the correct area to measure on a doll. It is best to take 3 separate crown rump length measurements. If all 3 images are good, average the values. If one is clearly better than the others, use that image alone to determine gestational age. The calculation of the gestational age will either be made by the ultrasound machine or can be done easily by looking at the crown rump length chart in your manual. Please pause the video now to find the crown rump length chart in your manual or download the participant manual from our website. In this view, notice that the fetus is in a neutral position, not flexed or extended, and in profile, meaning that you can see the face. Notice that the calipers are properly positioned on the top of the head and bottom of the rump. Please discuss the following questions in the group. Is this fetus in a neutral, extended, or flexed position? Is the fetus in profile? Are the calipers correctly positioned? Please pause the video now to discuss the answers. The answer is that in this image, the fetus is in a neutral position, in profile, with correctly positioned calipers. Here we have labeled the face. Here is another measurement of crown rump length. Please pause the video now to ask the group if the crown rump length can be accurately measured based on the fetal position, profile, and caliper placement. The answer is that the fetus is slightly flexed or bent, but is overall in an acceptable position. We can see the face, which means that the fetus is in profile. The calipers are also correctly positioned from the top of the head to the rump. Is this fetus in an ideal position for measurement of the crown rump length? This fetus is also slightly flexed or bent, but is overall in an acceptable position. The fetus is in profile because we can see the face. The calipers here are correctly positioned from the top of the head to the rump. In this image, please notice the crown rump length measurement and gestational age calculation at the bottom of the screen. This calculation was done automatically by the ultrasound machine. Most machines will have this feature, but you will still need to take the measurement of crown rump length. We can see here that a crown rump length of 4.5 centimeters corresponds with a gestational age of 11 weeks and 2 days. The computer's gestational age is only as accurate as your measurements, so measure carefully. Now consider the fetus in this image. Is this fetus in an ideal position for the measurement of crown rump length? Please pause the video to encourage responses. The answer is no. This fetus is slightly extended, meaning that it is in a straighter position than we would like. Looking at this scan, would you use crown rump length or the mean sac diameter to estimate the age of the fetus? Please pause the video now to discuss within the group. The answer is to use the crown rump length. Remember that crown rump length is more accurate than the mean sac diameter. If you see the fetus, do not use a measurement of mean sac diameter for gestational age. In this case, we should use the crown rump length to estimate gestational age. Now consider whether the fetus is in an ideal position for crown rump length measurement. Pause the video now to encourage responses. The answer is that the fetus is not in profile since you cannot make out the facial features. Try to get a better image, or wait for the fetus to change position before measuring the crown rump length. Even if the fetus is flexed, the crown rump length is always more accurate than the mean sac diameter. Please pause the video now to invite a volunteer to assess whether a crown rump length can be accurately measured using the fetal position, profile, and caliper placement in this image. The answer is that the fetal position is too extended to accurately measure the crown rump length. There is a slight profile because we can see a portion of the face. The calipers were placed correctly. Please pause the video again to invite a volunteer to assess fetal position, profile, and caliper placement. The answer is that the fetal position is not neutral and we cannot see the face. The calipers were placed correctly. Here is another example. Please pause the video again and ask another volunteer to assess fetal position, profile, and caliper placement for crown rump length measurement. The answer is that the fetal position is too flexed. The fetus is not in profile because we cannot see the face. The calipers were placed correctly. What is wrong with this image? Please pause the video to ask for reasons why the image appears poor. The answer is that the gain is too bright in the mid and deep zones and should be adjusted. We can't see the fetus well enough to accurately place calipers. The depth is also incorrect. With too much depth in this image, the fetus becomes too small to measure accurately. Set the depth to only be as deep as necessary, in this case, possibly 7 centimeters. Notice the dots on the right side of the screen that represent centimeters of depth. Let's review the key points. Gestational age is most accurate in the first trimester. Use mean sac diameter for gestational age only if you see a yolk sac. Once you can see the fetus, use crown rump length to estimate the gestational age. Measure carefully to get an accurate gestational age. Do not change the due date after the first ultrasound with a heartbeat, even if more ultrasound measurements are taken later. Questions for review. Please pause the video now to discuss these questions and answers among the group. What does the gestational sac look like on ultrasound? The answer is a small anechoic fluid collection in the uterus. Which structures must you see to confirm a normal pregnancy? The answer is either the yolk sac or the fetal pole. If you only see a gestational sac, when should the patient return for another ultrasound? The answer is that the patient should return in 2 weeks. Is fetal dating more or less accurate in the first trimester than at a later time? The answer is that fetal dating by ultrasound is most accurate in the first trimester. How do you calculate the mean sac diameter? The answer is to add the length, width, and height of the gestational sac and divide by 3. How do you measure the crown rump length? The answer is to measure from the top of the head to outer edge of the rump, and remember not to include the yolk sac. Thank you for your attention and interest in learning pregnancy ultrasound.